We have discussed quite a lot of questions, and this is going to probably be the last question for discussion on this topic. So, we all have a set of patients that are, repeatedly coming to us. They have got, I mean, they definitely have some good experience with us as a dental practitioner, and those we call as loyal patients. So, how do you keep a track of those patients? How do you follow up on them, and how not to lose them just because you are denying treatment of due to various reasons in this situation? So, what would be the right strategy? How to keep them, in track?
Yeah, I think that's a great question, Paritosh. And this takes me back to my own practice days. So when I used to practice, one of the mistakes I made was I never understood. I never had a good idea who are my most important patients. All patients are important, but at the same time, the practice is also a business and it needs to survive. And you need to identify who are your top patients. I never had a handle on that. So what I would recommend to most dentists now is go back to your appointment books for the last 3 years at least. See which are the patients that have been coming to you regularly. It's also very important to understand whether that patient is alone coming or the entire family is coming to you, because that means more trust if the entire family is coming to you. Also figure out who are the top patients who are referring a lot of patients to you, right? They may be in good dental health because they've been coming regularly to you, they've been good on their appointments, but they might be referring a lot more patients. Remember that if you do something wrong, then 10 people will know about it. If you do something right, then maybe that patient will tell one more patient, right? So very important to look at these two categories. Just make it very simple on your diary or whatever you're using. If you're very comfortable with computer, use an Excel sheet. Just list down your top 50 patients, right, who've been coming to you for the last 3 years. You can do a sort by revenue. That's a good idea. But if you feel sensitive about it, you can do a sort by number of appointments, right, they've taken. Then also measure how many from the same family have been coming to you. These are your top patients, right? You should never let go of them. You should do your best to retain them. Now, the add to this list, you can probably look at how many references you've had from that patient lot, right? There might be a patient A who's been coming to you, his wife B also comes to you, and he referred C, a friend of his or a colleague of his from office who also comes to you. Now, this A and B become your critical patients. They are your most important patients. Now, obviously, you should not deny any treatment to them. Make sure that you're available if they need you. But most importantly, keep in touch with them. Send them some information, send them some updates, send them any good practices in COVID that they can follow to maintain their health, maintain their dental health. Also on different occasions, today is Teachers' Day, for example, there was Janmashtami just went by, Diwali is coming up. Make sure you keep in touch with them. See, they are a part of a community and they are a family that is building your local practice. Whether you're a small practice, a large practice, or even very, very major healthcare systems, and I work with so many of them, they tried their best to keep in touch with their patients, their top stakeholders. So it is very, very important for you as a small clinic, which most dental clinics are, either you're one chair, two chair, or three chair practice, identify them and nurture them. It's very important. And this is one of the mistakes that I made, but I did not have a good handle on that. So my advice to you is, as there's slow down and there's a little bit of time to reflect, go back to 3 years, look at your appointment book, figure out who your top patients are, and see that you're in touch with them at least once a month. There must be something going out from you. Maybe a simple email or a WhatsApp message saying, hi, how are you? Are you doing well? Or this is something new that I have just found out and I want to share with you. And they will remember you, they will stay engaged and keep coming back to you. Obviously, before all that, you have to provide extraordinary dental service and good at your job, which I assume you are. That's why you're listening to us right
now. Yeah. Very, absolutely correct. So I think I've never been a dental patient myself, but I can relate that if my doctor is caring about me and if he's sharing some tips or any kind of maybe small videos as well, so that will definitely help me up and maybe recall my that I need a checkup probably just after the COVID. So thank you so much for sharing all these insights and tips. I think that would be really helpful for all our dental colleagues. And with this question, I would like to end the entire discussion here. Should there be any questions coming in, please feel free to use the comment box and do let us know so that we can get back to you. Thank you.
Thank you, Paritosh. Thank you for having me here. Bye.
Thank you so much, sir. Yeah.